Next speaker, Dr. M. Banathi.
Presenting author is Dr. Prithvi B.
Presenting also. Okay. Prithvi, okay. M. Banathi first.
Present a clinical trial which was done using a topical autologous platelet lysate. It's a drop used in chronic ocular GVHD as an adjunct therapy. Uh, Graft-versus-host disease. This is the immune response which has been between the donor tissue against the host tissue, where it is limiting the utility of the allogenic stem cell transplant, which is the only available treatment for the benign and malignant hematological conditions such as AML, aplastic anemia. Whereas ocular GVHD affects the productivity of the person. Chronic ocular GVHD accounts for around 60%, where the symptoms as a wide spectrum, where minimal involvement causes redness and photophobia, whereas an extreme and it can cause non-healing ulcers, stromal thinning, necrosis, stem cell deficiency, and even perforation. Conventional treatment, what we have is the lubrications and other supportive measures which do not address the root cause. The steroids and immunosuppressive has some benefit, but it has long-term side effects. There are so we needed some solution which address the root cause and which is permanent. There are some evidence which is showing that their biological replacements such as serum eye drops and platelet-rich plasma and platelet lysate drops, which can be used for severe refractive ocular surface pathologies. They contain growth factors and also anti-inflammatory mediators, whereas platelet lysate contains growth factors which is readily available because of lysis of the platelets. Growth factors has been readily available for the action. Till date, there are few international studies, and there are no Indian study based on GVHD or the use of platelet lysate. There are studies which is showing significant improvement by the end of 6 months objectively as well as symptomatically in GVHD patients, where they have used serum eye drops as well as platelet lysate. There was one study by Gabriel et al. Where confocal microscopy was used to assess objectively, which showed significant decrease in basal epithelial cell density, which is actually increased in dry eye disease. My objective was to evaluate a topical autologous platelet lysate as an adjunctive therapy in a severe refractive chronic ocular GVHD. It was a non-comparative study. Actually, I recruited 14 patients. We were 18 years and above with severity grade of more than 2 to 3, with platelet counts of more than 1.2 lakhs, without any systemic illness or infection, without any systemic infection. Among them, 2 expired because of the severe systemic involvement. 4 didn't follow up because of COVID. I could follow up only for 8 patients for 6 months. Where autologous platelet drops were prepared by using blood of a patient. I draw 100 ml of blood, which was centrifuged to get platelet-rich concentrate, which was frozen for minus at 20 degree for overnight and thawed in the morning to lyse the platelet, which was prepared in 20% solution, made into 5 ml vials. 4 vials were given for the patient for a month. One which has been used was kept in the freezer at freezer door at 4 degrees. The other drops were kept in freezer. They were evaluated at baseline 1, 3 and 6 months, where objectively symptomatical evaluation was done by ocular surface disease index questionnaire, and objective evaluation was done by staining of cornea, conjunctiva, hyperemia, and also the lubrications used at different period were taken into account, where it's reduced in number, and also the steroid use. Age, they were ranging from 18 to 54 years, and the second graph showing the time of recruitment from the onset of the disease. You can see the median time is around 270 days. It indicates that the disease has set in and there is no response for the usual conventional treatment. You can see that 80% majority of the eyes showed significant improvement symptomatically by the end of 1 month. Although the objective signs were improved in few patients by 1 month, the majority eyes, around 60%, showed improvement by 6 months. The individual parameters, if we analyze, it was a non-parametric skew data, so we used Wilcoxon sign rank test. There was significant improvement of ocular surface disease index scoring, symptomatic scoring, and also the tear breakup time, conjunctival staining, and also the frequency of lubrication was reduced by the end of 1 month. The corneal staining and shimmers showed significant improvement by 3 months. The visual acuity was also shown to be improved by end of 1 month, and also the conjunctival hyperemia, which was severe for the 62 patients, which was reduced to 6%, and 62% didn't add any hyperemia by end of 6 months. I analyzed the severity used based on NIH, DUCE criteria, also international criteria. All three showed there is significant reduction in the dry eye disease by the end of 6 months. Tear protein analysis and also MMP9 levels were analyzed using the ELISA technique, which didn't show significant. Statistically, they were not significant. This may be because of the small sample size of 8 patients. My limitations were the sample size, which was only 8, and it was non-comparative. Long-term follow-up will be required to see for the late responders, and also if there is any treatment failure. Standardization of the growth factors were not done, which will we can actually tell the every patient is receiving the same amount of growth factors. To summarize, the improvement of symptoms were by end of 1 month, and objective signs were improved by end of 6 months in majority of patients, with decreasing frequency of lubrication and also the steroid administration. All the grading systems showed significant improvement. So I conclude that APL drops serves as an effective biological replacement therapy, which can be used for refractive GVST patients. Large sample size will be required, with the standardization of the growth factors in the APL drops, along with analysis of the biochemical markers.
Thank you, but it's a good study. Actually, idea is good, but major objection is 3 patients. It should have been presented as a poster. But you need to continue this as a long-term thing, and you cannot conclude with 3 patients.
No, it's 8 patients.
8 patients.
8, but effectively 3 patients.
No, it was 14 patients I recruited. Among them 8, 6 months follow-up was done.
Out of that 3 patients data only you have.
No, sir, it was 8 patient total.
Okay.
8 patient total.
Data is of 8 patients, but I think we need to go ahead with double-blind study to prove the efficacy of this particular treatment modality.
We actually thought of giving through all the patients, because none of the patient was satisfied with the usual treatment, so everyone were requiring some intervention. So we thought of giving to all the patients.
Yeah, but analysis is also required, biochemical analysis in these patients. What you are using, how much is it effective, and what is the quantitative growth factors that are really available for the patient?
Yes, the standardization.
That is also needed.
Your concept is excellent, but you need to carry it forward.
Yes, sir. Thank you.
Anyhow, it is possible in our patient.